in a really unique moment right now, and there's never a time, frankly, when advocacy isn't important. But I think in this moment, because simultaneously we are faced with so many uncertainties, and there's no better or more powerful voice in advocacy than those who are actually doing the work, the experts on the ground, and that's our members.
So I think probably the thing that keeps me up at night the most would be just how are we going to continue to meet the unmet need?
My biggest concern is that if there are changes to the way that we're funded, if the funding is significantly decreased, we might be overextended and be unable to continue services and have to cut services, which could be devastating to our patients and to our community.
We became an FQHC in 2009 and we had 3,000 patients that year. We have 130,000 patients. If this current change in Medicaid cut us in half, we'd still be 20 times bigger than we were in 2009. These are people who contribute to our economy, and I don't want one of them to lose their benefit. I understand there's a need for change, don't get me wrong. So we need to figure that out and figure out how we embrace the Medicaid program differently.
Those are things that I'm really thinking about at night of what adjustments can we make to be resilient and work through these challenges and make sure we have plenty of healthcare access for the patients that need it most.
Well, I'd say what keeps me up at night right now is retention of the workforce and recruitment of others who are mission-driven. And I think that's a critical aspect of who community health centers are to this country.
You know, it's interesting, somebody recently asked me, is there any scenario in which you can envision that you will change your mission? And without hesitation, I said, there is no scenario in which we will change our mission. We will not ever, 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 we will never give up. What keeps me up at night is just how we will continue. You know, so we have that commitment, but all the logistics, all the basically scenario planning, what will we do if this funding is cut? What will we do if we lose staff here? What will we do if one policy changes? So it's really the how, but the why is always steadfast.